Right. Good evening, everyone. My name is Mohammed Al-Haj Ali. I am academic clinician, but today I'm wearing a different hat actually. So the hat of Syria World Society, the hat of the Global Refugee Forum Experts Group, and the hat of being like humanitarian as well. I know my job is not an easy job now, especially the last session on a Saturday, and only 5 minutes only for my talk. So I'm going to talk today about inequality in accessing health services by refugees. So in addition to all these like professional titles, I mean the closest title to myself actually, when I come to these meetings is the voice of voiceless people. The voiceless people, when we talk about refugee, we're not talking about just like one single group. We talk about crossroads in politics, spirituality, ethnic backgrounds, women's rights, children's rights, physical and mental disability as well, and healthcare issues. So I will represent what I presented in Geneva back in December about refugees and mental health. So there are challenges in resettlement environment. So I think it's better probably for me to talk without microphone. Is that clear now? Right. Yeah. So I'm going to talk about like challenges in the resettlement environment here. So refugees is a special or are a special subgroup of immigrants because by definition here, by default, there are sometimes perilous migration history can put them at a risk of number health problems, number mental health issues as well. Refugees frequently encounter barriers to care, culture mediation, and culture mediation improves the quality of care for socially disadvantaged population. Without adequate primary health care, acute and chronic health issues can go under-recognized and get worse as well in this group of people. When we talk about challenges, on the other side, always there are potentials as well in the hosting resettlement environment. Immigration can increase cultural and linguistic diversity as well in that hosting community, which requires further tools to maintain that diversity and cohesion as well. We all talk about nation of sanctuary, cohesion, diversity, but there should be tools as well to maintain that one. Cultural mediation improves the quality of care for socially disadvantaged populations. Social accountability, it's an important new principle now in medical education. And we're paying more attention now to social accountability. What is needed now to bridge the gap between refugees and resettlement environment or hosting community? We need health advocacy and community-based education. That's quite important. We need direct engagement in a community shelter for refugees. We need activity relevant to the community through helping newly arriving refugees as they come in waves. We need building up the right database as well on health and mental health issues for the refugees community. And now the next question, who, what and how? How are we going to do these things? So who's going to do this job? And that was my proposal in the Global Refugee Forum. It's a two champions job here. So a championing healthcare professional is very much needed here in the story. From the hosting country or the hosting community or resettlement environment. They should have a clear vision to understand the new issues and the ability as well to break the barriers towards inclusion and also access into the new system. We need, in my proposal, a refugee-led organization that will provide advocacy and also unlock the refugees communities to the new programs. It's useless sometimes that we plan for things. We do like loads of conferences and meetings, but we don't have the other party there. We talk about refugees, they're not in the room actually, and they're not engaging with us. And we want to unlock that community, and it's an impossible mission really, without having their voice heard in the room. So what refugee-led organization can do for us here? It's a channel for a two-way communication. They can identify the needs and the demands within that community, and that can be done very early actually by that early communication. They can also explain the cultural sensitivities around refugees community. They can create a trusted bridge as well between the health authorities for a better inclusion in the